On January 25, 2020, the first incidence of Covid-19 was identified in Malaysia and related to 3 Chinese nationals who had been in close contact with an infected individual in Singapore. Slowly, the number of confirmed cases rose. The Malaysian Prime Minister issued a movement control order MCO to slow the fast spread of Covid-19. The authorities prohibited travel to neighboring states and Covid-19 affected regions. The Department of Health MOH has produced detailed instructions titled Mental Health and Psychosocial Support in Covid-19. They included mental health and psychosocial support services for those under investigation for Covid-19, as well as the healthcare and response personnel engaged.
COVID-19 pandemic has been affecting the entire food system and has led bear its fragility, such as border closure, trade restriction, and governmental measure has been preventing farmers from accessing market, including for buying, input, and selling their product, and agriculture workers from harvesting crops, thus disrupting domestic and international food supply chain and reducing access to health, safe, and diverse diet. The pandemic has discriminated jobs and placed millions of livelihoods at risk. Breadwinners lose jobs, fall ill and die. The food security and nutrition of millions of women and men are under threat, with those low-income countries, particularly the most marginalized population, which includes small workers and indigenous people, and being hardest hit.
Now I'll be talking about the precautions of COVID-19. So the ways we can take care of ourselves from COVID-19 is to maintain a safe distance from others, at least by 1 meter. Second is to always wear a mask in public, especially indoors. Third, always clean the hands often with hand soap or even either uh, hand sanitizer. Fourth is to get vaccinated when it's your turn. When there's a chance for you to get vaccinated, please do get vaccinated. Fifth is to always cover your nose with and your mouth when you're sneezing. And lastly, please stay home if you feel unwell.
July 2021, COVID-19 healthcare personnel in the Klang Valley report that as a result of a lack of ventilators, oxygen and drugs, 19 patients are now staying in the intensive care unit ICU for significantly longer, sometimes for months. Going to work during COVID-19 pandemic has put frontline workers under a lot of pressure, sometimes that has never happened before. When frontline workers are exposed to too much stress for a long time, it can hurt their emotional and mental health in many ways. In the case of COVID-19, this could mean that the quality and safety of care isn't as good as it could be. How do they cope with the situation?
Hello. It's me, Ifara Biha. So I'm going to tell you how they cope with stress in the workplace.
First, put everything in proper perspective. Second, remain informed. Third, advocate for yourself. Fourth, maintain relationships. You could maintain your relationships by contacting your family, friends to release your stress. Fifth, maintain a healthy way of living. So this is my last word towards everyone. Even though COVID-19 is easing, we as concerned citizens should always wear face masks in closed places and maintain distance from other individuals. We need to appreciate the services that have been shown by the frontline in dealing with COVID cases. #Kita Jaga Kita.
The first impact of education on during COVID-19 is one of the limitation of emergency remote learning is the lack of the personal interaction between teachers and students. With book cards, this is simply too possible. However, several countries show initiative by using other methods to improve the remote educational experience, including social media, email, telephone, and even the post office. The second one is outside the classroom learning. Losses might translate into greater long-term challenge. It has long been known that decrease in tests are associated with future decline in employment. Conversely, increase in student achievement lead to significant increase in future income as 2 additional years of schooling, which when associated with an 8 to 9% gain in lifetime earning. And the last one is psychological impact. While the drop in academic scores is likely to be significant, we have yet to consider the effect on children's psychological development. According to UNESCO, schools act as hubs of social activity and human interaction. Long-term, school closures have disrupted this, causing adverse effect on academic capability and personal development. Students across all age groups have suffered negative impact on their social skills. For students who have struggled to attend online learning, they have been unable to keep in touch with friends and instead keep mostly to themselves.